Good morning, everyone. I'm honored to have the opportunity to present my PhD work at this wonderful conference. Actually, my PhD work focuses on applying a novel brain-based technology to treat smoking addiction. As a kind of chronic brain disease, smoking addiction is a preventable cause of disease and death in the world. First, I want to show some numbers. According to WHO reports, there are about 300 million smokers in China. Because of smoking addiction in each year, there are about 1 million people losing their life. So far, our government has put as much as 16 billion money, about 10 billion American dollars in battling against smoking addiction. When we know these numbers, maybe we should reconsider smoking addiction itself. Currently, available treatments for smoking addiction include pharmacotherapy and psychotherapy. However, high relapse rates is still a core feature of smoking addiction. Therefore, there is an urgent need to develop a novel approach to treat smoking addiction. Neurofeedback as a brain-based technology is a procedure which first acquires your brain signals in real time. Then these signals related to specific cognitive function will be transferred into visual information to present to you. Then you learn to regulate this information. Actually, the neurofeedback procedure is just like when you look at yourself in front of a mirror. You can learn to correct your bad performance. Clinically, neurofeedback has been employed in many brain disorders, include depression, anxiety, and drug addiction. This technology is regarded as safety and low side effects. So far, this neurofeedback technology has been employed into smoking addiction for over four decades. However, the clinical effect is only classified as probably efficacious. Why? Why is the effect unsatisfactory? In part, because the regulate anxiety and arousal in previous neurofeedback studies are not specific to addiction core process. Instead, previous studies in our group and other groups have supported that smoking cue reactivity is a central characteristic of smoking addiction. Therefore, reducing brain reactivity to smoking cues has the potential to improve smoking quitting outcomes. Based on these considerations, in this study, first, we developed a novel EEG neurofeedback protocol in which brain activity patterns corresponding to smoking cue reactivity were repeatedly deactivated. Then, we tested these neurofeedback effects from 3 aspects. The first is whether this neurofeedback produce effects on cigarette craving during short term. Next, whether the neurofeedback produce effects in smoking behavior during long term. Last, whether these effects can be predicted by the neuromarks at pre-neurofeedback. Okay, now let's move to method section. Our neurofeedback paradigm consists of 2 parts. First, we use machine learning method to train an individual classifier. This classifier was used to distinguish EEG activity patterns corresponding to smoking and neutral cue reactivity. Next, during neurofeedback, the smokers were asked to repeatedly deactivate their real-time EEG activity patterns of smoking cue reactivity. These pattern signals were calculated by previously constructed classifier. After we developed the neurofeedback protocol, we designed an experimental protocol to test the neurofeedback effects. The protocol consisted of 4 parts. The first is baseline session. The second part is 2 neurofeedback training sessions. The third is post-training behavior sessions. And the last is a follow-up session. 60 participants who met the smoking addiction criteria were recruited to participate in our experiment. By a double-blinded, randomized, and placebo-controlled design, these people were assigned into 2 groups. The experimental group, that is the real feedback group, their neurofeedback signals are from their own brain signals. The control group, that is the youth feedback group, their neurofeedback signals are from a matched participant in the real feedback group that is not their own brain signals. Okay, now let's move to results section. This picture shows that before neurofeedback training, no significant difference were observed in the demographic and clinical characteristics. This is our first finding. After 2 visits of neurofeedback training, the real feedback group, reflected as the blue line, successfully deactivated their neurofeedback signals, that is the smoking cure activity pattern signals. But the youth feedback group, reflected as the yellow line, did not. We also found in the real feedback group, the participants can significantly decrease the cigarette craving. Additionally, the participants with no year deactivation levels in previous neurofeedback performance showed a great decrease in their cigarette craving, but the youth feedback group did not. Interestingly, we not only found significant behavior effects in cigarette craving, but also found neurophysiological effects related to cigarette craving. That is, after 2 visits neurofeedback training, the real feedback group can significantly decrease the P300 potential, and the participants with a higher or with a greater P300 potential showed a greater decrease in their cigarette craving, while this finding is not observed in the youth feedback group. There comes a last question. What's the relationship between the neurofeedback performance P300 change and the cigarette craving change? We conducted a bootstrap mediation analysis. The result indicated that the P300 change can partially mediate the relationship between the neurofeedback performance and the cigarette craving change. The expectation is our expectation is the long-term effects on the cigarettes amounts during long-term. Remember, we just train smokers through 2 visits of neurofeedback training. It can really reduce the cigarettes amounts per day at 1 week, 1 month, and even 4 months. Additionally, the temporary changes the temporary changes in smoking behavior induced by the neurofeedback is not simple decrease change, but is a U-shaped change. The last interesting question we are interested is, can we predict these short-term and long-term effects? The answer is yes. For the short-term effects, we found the participants with a higher classification accuracy of the pre-neurofeedback classifier showed a greater decrease in cigarette craving. For the long-term effects, we found the neurofeedback performance in the first training cycle can predict the final cigarette amounts at the 4 months follow-up. To sum up, in this study, we developed and evaluated the novel neurofeedback training. And by a double-blinded, placebo-controlled and the design, there are 3 key follow findings. The first is the neurofeedback can produce the psychological and physiological changes in cigarette craving during short term. The next is the neurofeedback can produce smoking behavior changes in cigarette amounts during long term. In particular, the rates of the cigarette amounts decreased as much as 38%. The last is both these effects can be predicted by the neuromarks at pre-neurofeedback. In conclusion, this neurofeedback is maybe a promising treatment for smoking addiction. Last but not least, we will conduct 2 tasks. First is we will optimize the neurofeedback training sessions. And the second is we will explore the brain mechanisms of the neurofeedback effect. Thank you. Thank you for your attention.
Okay, thank you, Junjie. So because